Hey, welcome everyone. I'm Ben Johnson, Associate Professor in Student Leadership and Success Studies here at UVU, Utah Valley University. With me, we have Christian Anderson, Associate Professor of Higher Education at University of South Carolina, and Associate Professor Chris Goslin, also in Student Leadership and Success Studies at Utah Valley University. We're going to be talking today about the topic, if past is prologue, what does this mean for a post-pandemic America? And we have two experts joining us here. We're going to talk about the past. Dr. Anderson is an expert on the Spanish flu epidemic from a century ago. He'll give us a quick kind of overview of that period. Dr. Chris Goslin will then tell us a little bit about current and future trajectories in the situation with the pandemic, now and in the future. Then we'll have some questions that we'll entertain among ourselves. And then if you have questions, we look forward to seeing those as well. So let's get right into it. So as we know, we're still in this pandemic, and some of the questions that futurists have is as they try to project the future, and often they're better at mapping it out, 10 years as opposed to 20 and 30 years, obviously, and they look at the past, right? They look at the past for ideas, to kind of understand signals that might lead us to know where to go for the future. And so, what will it look like? We seem to be in a trajectory where we're moving out of the pandemic. We've had the Delta variant currently. What are the implications for higher education, for ethics in general, for policymakers, for public officials, for technology? What are we seeing with the influence on some of the trends in society as far as conflict and governance? And so these are some questions that we'll discuss and look forward to getting your input on that, both from our expert presenters and any questions from our audience. So Christian, why don't you go ahead and take it away from here and tell us a little bit about your expertise.
All right, well, thank you for having me. I'm actually a native Utahn, so it's fun to be back in Utah for a moment, even though I'm streaming here from Columbia, South Carolina. I've actually spent some time on the UVU campus, so I appreciate the invitation to be there. When the pandemic hit last year, I said, well, what's going on? All of us said, what's going on? What is this? How did we get here? And we all started asking, well, has this ever happened before? Are there any precedents for this? As a historian of higher education, I immediately started looking at what precedents there have been for pandemics and how they have affected higher education. And the biggest example, of course, is the 1918 Great Influenza, oftentimes called the Spanish flu because it was believed that it originated there. It actually probably originated in Kansas, should be known as the Kansas flu. But in any case, I've spent the last year both on my own and with my students looking at how higher education was affected by the Great Influenza and how they responded to it. And one of the ways that we've looked at this is, of course, we haven't been able to go search archives at various universities, but most college newspapers are digitized. So we've been able to look at college newspapers. And I thought that what I would focus on today is something that we can all relate to, which is college football. So if we look at this newspaper from the Ohio State University in October of 1918, you can see the various headlines about the influenza, about quarantine rules, some mention of World War I and a World War a course being created on world wars, and of course football. One headline says this is a good time to catch up on your work. Another headline says, follow the instructions on this page and check the spread of influenza. All things that we can relate to today. Of course, what interests me the most is the fact that quarantine rules will not affect the football game. We have been football crazy in this country for over 150 years. The first football game officially, we say took place between Rutgers and Princeton in November of 1869. Got off to a slow start, but pretty soon we were all possessed by this autumnal madness. And certainly by 1918, it was as a huge game taking over campuses on Saturdays. If we look at how many games were played in 1916, pre-pandemic, and 1919, pandemic was still going on, but certainly waned. We see that 1918 was severely affected by the pandemic, both in terms of number of games and in total number of games, and in number of games played before November. Part of my headline got chopped off there. Also during and some historians have blamed World War I on the truncated 1918 season, but that's not at all accurate, because even Army bases fielded college teams with college players. And in fact, 2 military bases played against each other for the January 1st, 1919 Rose Bowl. And so it wasn't truncated by the war, it was truncated by the flu. But it did not stop it. As you can see, in November, they picked back up and played the rest of their seasons. Some teams had their seasons completely wiped out, or their last game, or certain games cleaned out. I had to bring in this example of masks from 1918 because I thought it was so clever, and it pains me who came up with that cleverness. You can see that it's from the White and Blue, the BYU newspaper. So as a University of Utah alum, that pains me to give credit to the Cougars, but there you are. So that brings us to the current situation. As we all know, in 2020, football schedules were curtailed. Some conferences canceled altogether. Many teams only played conference games. BYU, as an independent, had to scramble to piece together a schedule, and in fact, came all the way here to South Carolina to play Coastal Carolina on basically a minute's notice. And then here we are, and then I couldn't avoid a nice jab at Clemson. We're number one. Well, yes, in COVID cases. They were number one in football rankings at the time, but also in COVID. And here we are in the 2021 season, and some stadiums have required a proof of a negative test or proof of vaccination. Some are requiring masks, and some are not imposing any restrictions at all. So, as this is a conference about ethics, here's a key question. What will the impact of this be on campus and public health? Certain claims are being made that it's not having an effect, but I'm skeptical. Last year, this was an update, a news update from Indiana, and they had a record high 5,000 cases on Saturday. And what happened that same Saturday? Notre Dame beat Clemson. And then, of course, what was the score for COVID? Unless you think I'm making fun of everyone else or taking jabs at everyone else, here's my campus. Just 4 days ago on Saturday, SEC Nation held its game day event here on campus. There's Tim Tebow. I took that picture as I walked past him to the historic Horseshoe of USC. These are images from the Horseshoe, the historic heart of campus. And there's the game on Saturday. You can see a lot of sandstorm towels being waved, but if you can find a mask in there, please let me know.
Thank you, Christian. Dr. Anderson, appreciate it. Chris Goslin, go ahead.
Okay. Okay. Yeah, great presentation, Christian. That was excellent. That was amazing. So from kind of what's happening now, and you know, what's the impact in the future? As Ben said, anyone who tries to forecast the future is, you know, they're heading the wrong direction. But we'll give it a go, and we'll see how this thing works out. So let's look at the first slide here. And that is American pandemics. I thought Dr. Christensen did, or Dr. Anderson did a great job of kind of laying out the, you know, kind of what happened through the histories. There have been, here you have kind of a definition of what an epidemic is defined of by the Center of Disease Control and Prevention, and the spike in the number of cases. This is a great article kind of talking about the worst outbreaks in history in terms of the United States. Smallpox for European settlers, yellow fever from the Caribbean. Anyway, we go through several of those. Typhoid Mary, that's probably one that we haven't heard about for a while, but at the time that it occurred, it was a huge, huge deal. The peak of polio, of course, and then we go down right now to in 1980s AIDS, and in 2020 COVID, right? So we have had a long history in the United States of dealing with those, although kind of the two we're zeroing in on are the 1918 flu and of course COVID right now. Let me get to the next slide. Okay, so some interesting research on kind of what is happening with COVID. Here's some interesting articles that you can kind of pull up. These are some really interesting things, but generally this is kind of what at least the early research is suggesting. Individual countries face stagnation and recession, possibly leading to a global recession, and especially those that are less developed countries. Now, the United States is not immune to this, because if we look at this, virtualization of communication is an important change. And look, now we're having an ethics panel discussion online. Would we have done that in the past? Sure. It would have been maybe a little more unique, but this is like the way it is done now, right? I mean, everybody knows about Zoom. Everybody knows about things like Teams and how we negotiate those technologies. Every kid in school knows how to do these things. Every college kid knows how to do these things. Matter of fact, my students are asking me right now, hey, I know that we're in person class, but can we still do them online? And so this is kind of been kind of a big change, and has become a vital part of our lives. The other thing that research is saying is the poor and vulnerable face hardships as job loss increases. This is especially true with folks who don't have technology jobs, or they don't know how to use technology. So it begins to get hard in every country, including the United States. Isolation among elderly and those without access or familiarity with technology is much more pronounced. So you think about, I can think about my own family. My parents kind of struggle with the whole technology thing. They never kind of engaged in that. Although my wife, my in-laws, her parents are much more tech savvy. He was a professor. That was his career growing up. My father was a mechanic. And so I think that kind of echoes kind of what is happening. Also, since it belonged to a community has been diminished because of isolation. Here's the impact on education, generally speaking. Globally, over 1.2 million students are out of the classroom. Result in education has changed dramatically with the distinctive rise of e-learning, whereby teaching is undertaken remotely and on digital platforms. That's probably not a surprise to anyone. But let's look at higher education in the US in general. This is a great article, and it's really kind of talking about some interesting things. I pulled out one of the graphs because I thought it was very interesting and very kind of germane to what we're talking about now. So students find the following items challenging if they were learning to if we were to continue to continue online. So if we continue to stay online, this is what all current college students are saying. They're saying it's going to be really hard for them to stay motivated and learn. If we look at Black college students, 74% of them say, it's going to be problematic. Latinx students, 84%, and high school seniors, 86% of them said, man, it's going to be tough for us to, maintain our motivation. Then you kind of look at the other kind of things that they're looking at. Learning for peers, 75% of them are concerned about that, of all college students, while 60% of Black college students, 73%, and 79% of high school students are concerned about those things. Interacting with professor, you kind of see the numbers right here. And then having access to student support, big concern for, amongst all of those constituencies as well. So kind of, if you look at kind of what the faculty are saying, according to Inside Higher Education, these are kind of the things that the faculty are worried about in general. Like Leslie would think that most instructors have gotten overly confident. You can read this. They are getting more and more competent in delivering technology-enabled learning, but the challenge for that is most of the faculty are warning that these are going to affect students from low income and other disadvantaged backgrounds, which is why 2/3 of the survey instructors said they were concerned about equity gaps. And so because of COVID, you may actually see an increase in equity gaps because of limited resources and or not being familiar with how to use technology in general. So this is kind of what is happening in higher ed right now. So what does that mean across the board for higher education? Growing importance of soft skills. So if you have a bunch of people that are sitting behind screens, it may be harder, especially if they're doing this as elementary kids and then as middle school kids and high school kids, and then also in college. We're really going to have a lack of soft skills. We're really going to need to do something about soft skills. An authentic assessment is going to be another kind of thing that we're going to need to be concerned about. Also, traditional education, they're saying, according to University Business, is going to be unbundled. And what that means is this. We may see an increase in students deciding, you know what, I'm not going to take classes on campus because I haven't been doing that for a year. Instead, I can keep doing this, right? And it's cheaper for me. I don't have to move away from home. I can keep my job here. I don't have to pay for a new apartment or get a new job, And in some cases, right, education that I don't have to pay student fees. So it might be actually cheaper for me to do kind of an a la carte thing online instead. I'm just going to take these classes. I'm not going to do the student fees associated with things. I'm not going to have to move. And that's what I'm going to do. We also have a massive increase in rise in students' need for connection. I'm teaching face-to-face right now. And even those students, everybody keeps telling me, every student I talk to, it's like, we just feel so disconnected from everyone, everything. We need to feel like we're connected to people again. And of course, the disadvantaged, again, are the ones that are going to have the most significant impact because of the virus. Then there's some debate going on, right, about science, power, and politics. I'm not claiming to come down on either side of these things. Here's what this article was saying: the real cost of polarization. Just want to pull your attention to two items. Beliefs about the COVID pandemic and social distancing behavior is driven primarily by political affiliation. That's according to this article. I'm not necessarily backing that. And also they explain how political partisanship arises from these differences in beliefs about the virus propagating into the adoption of state policies. And so in other words, what they're saying is like different states are adapting different policies, and then there's begin to be polarization about the policies implemented by different states about the virus, how best handle the virus, which I'm sure that comes as a surprise probably to no one that is happening. Okay, so broadly speaking then, so we looked at higher education and we looked at kind of some of the general mandates. What are the broader costs to the US as a society? And I'm just going to pull out a couple of these because we don't have a ton of time. We can talk about these more later and maybe the dialogue. At least half of households in the 4 largest US cities, New York, 53%, Los Angeles, 56%, Chicago, 50%, Houston, 63%, report serious financial problems, including depleted savings and trouble paying bills or affording medical care as a result of either loss of jobs or inability to go to jobs, especially those who are like kind of more the blue collar workers. That is a big deal. Also, this one right here. More than 1 in 3 households that include anyone with a disability reporting serious financial problems. Many experiences difficulties affording utilities and food. Wow, so that means if you have a disability going in, it's going to be even worse. And then finally, this one, 1 in 5 households in the United States, 20% report household members unable to get medical care for a serious problem. A majority able to get care when needed. 57% report negative health consequences as a result. So that is a lot of folks because our hospitals are filling up with COVID cases. And here in Utah, where I live, we've had a resurgence because of the Delta virus, where a lot of especially our intensive care rooms are being taken. So they actually are having to triage a little bit and saying, okay, who is most likely to live if we can treat them, which is a big thing to say. And then the last thing I will say, this comes from the Center for oops, I ended early. Center for Strategic Studies, Strategic and International Studies. They kind of look at these 7 trends, and one of them that they look at, they look at all 7 of these trends in this article. You can click on it for more of this stuff. But I thought the one that was really interesting was this. When you look across kind of the globe, so now we've moved from higher education to U.S. society in general to kind of broader predictions about what may happen in terms of governance. So you can see political awakening as an indicator, immediate impact, surging citizens' expectations for mass protests, cause trigger inequity and injustice. We've certainly seen mass protests in various countries, states, in the US, countries around the country. So friction between public expectation and government responsiveness leads to long-term unrest or social reform. You can see that one. This one to me was one of the big kind of things is democratic decline. So crisis-driven authoritarian consolidation. So you have, like, in some countries, authoritarianism is kind of, they're consolidating their power as a use of as a means of controlling their populations. And finally, trust, surge in initial trust, government and expertise, but also ultimately an enduring trust deficit among the younger generations, especially millennials. So those college students and those high school students who are kind of looking and saying, man, you keep telling me that this is going to work, it's not working. So they're starting to lose trust in our institutions. And that's kind of happening around the globe. And that is my presentation. Back to you, Ben.
Thanks to you both. Appreciate it. Lots of good content there. First of all, I just want to make a couple quick comments. As we look at, like I talked about at the beginning, we uncover patterns, we look at signals for the future, and we look at the past and we ask, why is this happening? How could this be happening? And what happened, right? And that can kind of help us change our view of the lens that we might have on the situation, right? It might change, right? Our paradigm might change. So we look backward to see forward, so that we can understand, right? And I think we see that with what both of our panelists are talking about, even mask styles, right? We have ongoing themes that continue today. We have football games where maybe everyone's vaccinated, they're not wearing masks, right? so those are questions, right? As I saw the excerpts, Christian, from the Ohio State Lantern, where I'm a Buckeye, got my PhD at Ohio State, and so I appreciate seeing those historical connections and those continue to the present. The need for soft skills, online fatigue. So we kind of, with Chris Goslin, we have a different focus, right? We have students who are used to, not coming to campus, not going to those football games. And so, but they still need those soft skills. How do they gain those skills? How do they do it in a way where they're able to connect with each other, right? So these are the kind of the ongoing questions. And so what I'm going to do is ask some questions. Feel free to ask questions to each other. We have a couple of questions in the chat, and then some questions that we've also raised among ourselves. I know that we want to talk about. So I'm gonna ask this question from the chat right now, but feel free to also get into some of the questions that we were going to talk about as well. How has the pandemic affected educators' propensities towards covering controversial topics in classrooms? Has it had a chilling effect? Let's go with Christian, please.
I think it probably has. And we've seen these incidents that show up in the Chronicle of Higher Education, Inside Higher Ed. Some of them make it onto the national and local news of, someone left their Zoom on and, had a conversation afterward that is recorded. Or even if the Zoom class isn't recorded, nothing, stops someone from holding up their phone and recording the Zoom. They turn their camera off and then they record it, or it is recorded and, a student broadcasts that out there. Oh, look what Professor Johnson is teaching. Look what Professor Goslin is teaching. And of course, we all know you can take a snippet. It's an hour lecture or it's a 50-minute lecture. I can take a 10-second or 1-minute snippet and take something out of context and make it look like it, something, totally different. So I think it's made people maybe look over their Zoom shoulder a little bit like, oh, do I really want to put this out there? Here we are on YouTube. What if I make a faux pas? I stumble on my words and say something that I didn't mean to. Well, in class, with nothing being recorded, I can probably recover from that. If it's out here on the internet forever, how do you fix that?
Chris, you have a comment?
Yeah, absolutely. I actually agree with everything Professor Anderson is saying. But what I would add to that is this. In addition to like all of the things that he said, I think that you also have a bunch of people right now who are still in lockdown or still in quarantine. Or they're worried, right, about catching it. So they may be isolating at home and they're looking for information, right? And they may stumble across these classes or YouTube things. I just think you have more of a captive audience who's probably interested in those things, right? And maybe clips that wouldn't go viral, before would now, because you have an audience, right? That's captivated and concerned about these issues.
I'm going to throw the next question back to Christian again. How did schools convey classes during campus closures in the 1918 influenza pandemic? It's not like they could have moved classes online. Can you tell us a little bit about that?
Are you trying to tell me there was no Zoom in 1918? They didn't continue classes. They just canceled. They just said go home. That was it. They might. Maybe I'll keep looking to see if professors or presidents said, well, read a good book while you're at home, or like Isaac Newton did during the plague, invent calculus, or like Shakespeare, write King Lear, like he did. There might have been some of that, like read a good book, but they didn't. I mean, they're I guess had they known it was going to last a long time, they could have done some kind of correspondence, because correspondence education did exist in a very primitive way. But no, they just said go home, get better, or stay well, and we'll be back here in 1 week or 2 weeks, which didn't always happen. Sometimes it lasted longer.
Yeah, it reminds me of Boccaccio and the Black Plague, right? With the stories about the Black Plague, and it's interesting because some of these pandemic stories, even the 1918 one, personally didn't really resonate with me in my undergrad experience, or even in my advanced historical training. I didn't spend a lot of time. Really, that wasn't a focus for me. Now it's a lot more interesting. And so it's interesting how we can investigate these patterns when they're relevant to us. Then they matter a little bit more, obviously.
Well,
Chris, you have a comment? Yeah, go ahead.
It's funny that you mentioned Boccaccio, because my wife is a professor of German and comparative literature, and she's teaching a course on pandemics in literature, and she she teaches the Decameron by Boccaccio. And
That.
and so I've actually read, some of this stuff along the way. And of course, I also study higher education and popular culture. And so it's been an interesting conversation to talk about this. And of course, she knew about the Decameron, but she had never focused on pandemics. But kind of like me with my historical question, she said, well, how have authors portrayed pandemics in literature? And it's been fascinating to watch what she's uncovered along the way. And interestingly, since we're focusing a lot on the 1918 pandemic, that is the least written about pandemic, both historically and in literature. There's basically one novella, Pale Horse, Pale Rider. But other than that, very, very little.
So my historic lack of interest is not new. There's an opportunity here. So for people who want to write about this period. Chris, go ahead.
Yeah, a couple of things for 6 months. One was she did a dining dash, right? Kind of service. So a restaurant service. So she would use those to get food. So the person from that, and then she had her groceries delivered. So that person, although she wouldn't even see them sometimes. I mean, sometimes they just leave her on the, ring the doorbell. But sometimes she said, I just wanted to see somebody, right? So I'd open the door and say hello. And then there was a neighbor down the hall that she would wave to. And so for 6 months, that's how she isolated. So you have a lot of people who live alone, and the research also said this too, that we're kind of working at home and living alone in large communities, but we're really, really isolated. And you see kind of that thing too. I mean, if you look at urbanization, right now, the country's much more urbanized, right, than we were in 1918. So you have a lot of small towns in 1918, and it comes, it seems like those towns would probably be isolating in towns, right, where they kind of post people out and say, no, we don't want you to come in and get give us the virus. So we're going to make sure that doesn't happen. So I'm just wondering if isolation occurred differently, if you were isolating in communities versus isolating as individual people or small family kind of groups. What are your thoughts?
I don't know the answer with great precision to that. I know that some college towns debated whether or not to send their students home or to keep them in the island of their college town. For example, at Clemson, they said, let's keep everyone here, because if we send them back throughout the state, then if they're sick here, they're going to take that back. Mm-hmm. And so, some college towns try to kind of create a college, a town bubble. And if you're a small town in rural, wherever, with, 75 or 175 people, you might be able to accomplish that. But, every person beyond that, I mean, it becomes increasingly difficult. So,
yeah, I would think that, right, in those small, very small rural communities, that maybe you could actually isolate as a community rather than as an individual, where you have groups of 75 to 100 people. So for me, it would be interesting to see how many rural communities would kind of fit into that niche back in 1918 versus out now, right, where we have large, primarily, I mean, most of Americans live in urbanized areas, but they're isolating. They have more access. The other problem, right, is now we have more access to technology. We can still do our jobs. We can hear about the news. We can get these, all the stats about the disease. Where if you're isolating in a small community, you're getting no news, right? There's nobody's coming in. Maybe they would allow somebody driving up to their street and throwing a paper into town, but I don't know. Maybe that wasn't even a thing. I suppose it's hard to kind of figure that out, but yeah, I just think the isolation now versus then was a very, very different kind of thing.
Isn't there even a story of a town that the mailman brought in the flu, and that was the source of contagion? Everyone was fine, and the mailman brought it in, and boom, it doesn't take much to spread.
Yep.
It's interesting to compare those to the costs of isolations, past versus present, and what that would mean. What that means. How different is it on people psychologically, right? Versus the Zoom kids of today, right? Versus those of a century ago. There's a couple questions. I'm going to kind of conflate two questions in the chat here. Okay. Were there any factors within the 1910s America that led to the politicization of public health apparatuses? And did the backdrop of World War I serve as a unifying factor that primed Americans for a less divided response to the Spanish flu? So it's kind of a cultural political question, but let's start with Chris Goslin, and then we'll move to Christian Anderson.
Boy, that question about the backdrop of World War II serving as a unifying factor, I think, is a great question, right? Because now, there does seem to there's kind of been a polarization and a politicization around, which techniques are better. Or extreme isolation, is that going to be the best thing? Or just having a mask mandate, is that the right thing? Or once we get a vaccine, are we okay to do stuff then? So there's been a polarization around those issues where, it makes you wonder, doesn't it? Like in World War I, we were, as a country, we were united as a country to defeat, right, the opposition. So maybe I could, I would, this is just be an opinion on my part, right? But it would seem like that could have been true, that because in 1917 the war starts, right? And like Dr. Anderson said, it really kind of comes out of canvas, specifically barracks in Kansas, right? So it actually came out of as a result of the war. You could have seen people politicizing that, right? Saying, "Oh, it's because of the war and people getting in these barracks that, so we shouldn't be at war." But you didn't see really any of that. I mean, I think that's a great question, and it makes you kind of wonder. Well, would someone do something like that now? Would they create some kind of, massive instance to kind of draw our attention away from, or any country, would a country do that, right? Would any country say, okay, this thing is really getting the best of us, so let's have this other issue that will unify us, so we don't have to worry about, kind of the pushback.
Well, I'm really glad that you invited me to join in this panel. I'm not an ethicist, so I didn't know, even though I love reading, the ethicist is the first thing I read in my Sunday New York Times every week. So I didn't know exactly what I'd have to contribute, but this has definitely contributed to me, because I've been doing this research on the campus response to the pandemic, and I've been, maybe a little too focused on the campuses and haven't done as much about the context. And even though I preach to my students, context, you've got to know the context outside of campus, and I haven't really practiced what I preach on that. Not that I didn't plan to, but just haven't quite gotten there. And this discussion so far has given me two lenses to really think through as I'm doing my research going forward. One is this issue of isolation. I think that, we're all zoomed out. I'm sure all of us would prefer to be in person, there in Orem and not on Zoom. We're all zoomed out with meetings, classes, everything. We have a family Zoom that we were doing once a week. Now we've gone back to once a month, and it's great. And it was a great way to stay in touch. But in 1918, there was no family Zoom. There wasn't even long distance phone calling for most people. I mean, it was true isolation, writing letters or reading about it in the newspaper. And so, that's given me a lens to think about, well, what was isolation like in 1918? And the other thing is this issue of politicization. So I'll give you two examples that I know of. One is that, everyone's isolating in Philadelphia, and then they hold a rally to welcome welcome home the troops after winning the war, and it creates the biggest spike in influenza cases in Philadelphia. So yeah, it brought everyone together, but it also got them all sick. I do know there was some opposition to, kind of like there is today of, well, this almost anti-public health attitude that, it's hard to understand sometimes. And I hate that it happened at my own alma mater, or in my own home state of Utah, but the faculty at the University of Utah in 1918 proposed a study to do a statewide study of how the flu was spreading and how and what was going on. And I think it was the state legislature that nixed it and said, no, we don't need to do that. We're not going to give you any money to do that. We don't want you to do that. I don't remember the exact details, but the government basically said, no, let's not do that. And so, now this causes me to really think as I'm going forward about these two issues more deeply as I'm looking at all of the data about what happened. So thank you I don't know if I contributed anything, but you certainly helped me. So thank you.
Well, I feel like you're definitely, your historical knowledge is excellent. It's fascinating. So that's also kind of helping me to kind of, reframe some of the research I do going forward. So it's the same.
It's interesting, the religious and sort of ethical and religious implications as well. Is this God's, bringing in the flu at the end of the war, or the Americans joining the war? Maybe that's a reason for it. It's why did we join the war? And so, the proliferation of the flu. I'm wondering if that was a concern at the time. There's some discussion of that today, I think, in religious circles, and is this the last days, or that type of thing, right? And what's interesting is just the mere numbers, right? Of how many people died. 50 million people died, right? I believe, and among 1.8 billion people in 1918, versus we have 7.9 billion, and only about 4.5 million people have died. Now, so any comments on that, the population consideration, or the disparity and the difference?
Yeah, that's interesting, right? Where if you take percentages of population, world populations, right, and then also where the deaths occurring, like are a majority of that 4.5 million people, is that happening in developed countries or developing countries? Same thing with the Spanish flu. Where do those go? And then you look at the population as a percentage. Obviously, it seems like the Spanish flu, even if we go with Dr. Anderson, over 17 million. Quite a bit less than COVID, right? Massively less in terms of percentages. So it makes you kind of think, well, why is that? Why were there more numbers there? Could have been, of course, obviously, it could have been more communicable, that disease as a percentage of populations. Maybe they weren't isolating enough, or it was public policy, against kind of things like that. And with the war on, and I'm sure the war had an effect on that as well. That's a really interesting question in terms of percentage of population who are doing this. And then the other side of that would be like, well, are we overreacting? Or have we overreacted to some of the policies, or have we underreacted? I saw a stat that said, an article that said that we just passed that this was the highest number of people in the US that have died from an epidemic. But so for me, the number I would look at too is like, well, there's way more people, right? And are we in some cases, are we just assuming that that's a COVID death when it could be something else, especially with our elderly? And then percentages, right? As a percentage of population, actually, that would not be true. The Spanish flu, if we want to call it that, would have killed a much higher percentage of the population than now. So, yeah, I think that's a good question.
Well, and one demographic note I saw the other day is that Alabama in 2020 had negative population growth. They had more people die than were born for the first time in its history. And that's quite a remarkable thing. The one other demographic thing that I'll comment on from 1918 is, and this is something else that I need to continue to explore, is the gender differences. And one thing that gives me an easy point of comparison are the women's colleges and the men's colleges, because there were way more women's colleges, especially as a percentage of the total colleges, than there are now. I think we're down to about 60 women's colleges nationwide, and 2 or 3 men's colleges, men's only colleges. But back then, of course, many universities and colleges were for men only. And one example is Harvard and Radcliffe being the women's, auxiliary to Harvard. Both of them got the same news, were in the same town, down the street from each other. Harvard charges forward, says, we'll be fine, has, I think, 5 students die and 40 students get sick. Radcliffe says, ladies, go home, isolate, be well. I think it had 20 or something students get sick and none die. So, the women were responsible, the men, not so much.
That's an interesting question. The gender roles, and that would be another interesting, if a student or someone else is interested in discussing, and exploring that, how do genders react to moments of pandemic? So we're going to wrap up, but are there closing comments or questions that you each want to make before we wrap up here? Thank you for your time. This has been informative.
Just to say thanks for having me. This has been fascinating discussion and a lot of fun to be here.
I agree. I mean, I think this has been great. It's been an excellent discussion, and I agree with what Dr. Anderson said about, like, oh yeah, this is definitely piquing in terms of research, right? It's definitely piquing my interest in terms of other different ways that I could look and do research about these kind of topics moving forward. So thanks for having me. Yeah.
Thanks very much, Dr. Anderson, Dr. Goslin, for joining us for Ethics Awareness Week. We have recorded sessions already posted on the website, and then future sessions tomorrow will start up again. So make sure you join and ask those questions and consider participating again in another Ethics Awareness Week. Thanks very much.
Thanks. Take care.
Bye-bye.